Seth, thank you. New safety concerns over ICE detention facilities in Georgia after a Mexican national died while in custody in Clayton County. ICE officials say 34-year-old Herbert Sanchez Dominguez died at a processing center on January 14th, just days after his arrest. Officials reported the incident as an apparent suicide, but the Mexican consulate general is now requesting clarification about the circumstances surrounding his death. Sanchez Dominguez is the fifth person to die in ICE custody in the country this year. And if you remember, last June, another man from Mexico, a 45-year-old, died in ICE custody in Lumpkin. Officials said he was discovered unconscious with a ligature around his neck in his cell and later pronounced dead. However, the cause of his death is still under investigation. So these two incidents, along with recent shootings during immigration operations in cities like Minneapolis and Portland, now raising some serious questions about the enforcement practices. Joining us now to talk more about these detention centers is Amilcar Valencia, the executive director of El Refugio, an organization that helps migrants start being held at the detention centers and helps their families as well. So tell us, why are these advocates calling for more transparency from federal authorities in this particular Georgia case?
Good morning. Yes, the investigations has to be done correctly. I think there is a lot of to learn from the people who died in the detention centers, especially when ICE releases the information about their death. It sometimes is very unclear what happened, and most times families do not receive information about medical issues that people might have when they were detained. So it's important for us advocates to continue calling for a full investigation on the death of the people who died in this case of Mr. Ever Sanchez, and of course the case of anyone else who had died last year and the previous years in immigration custody in Georgia.
And so in both of these Georgia incidents we're talking about, officials have said the deaths were suicides. What should these facilities be doing to address mental health for people being held in custody?
The reality is that, of course, issues of medical neglect are apparent in these facilities, but also people who are receiving, sometimes are dealing with severe issues with mental health are not receiving proper attention. There have been incidents or cases of people who have died by suicide at the detention center, and they are really not receiving any attention. They're not receiving any care in these facilities. As to the detention center, in particularly, there have been 3 deaths by suicides. And it is concerning because a lot of individuals, again, have these issues already documented, and they're not receiving the proper attention. The case of Mr. Jesus, who died last year, we don't know any information besides what ICE released during the investigation, but there is nothing else that we know about the apparent death by suicide. The similar case of Mr. Heber. Now we need to know exactly what happened. More importantly, is we need to ensure that people who are in the detention center are receiving the proper attention, not only medical attention that most times is locked, but also important to see what are the issues that are dealing, mental health issues that are dealing, and what is it that the facilities are doing in order to treat those issues.
And so tell me, from your perspective, how has this shooting in Minneapolis by an ICE agent and these public response shifted the conversation around ICE's issues with use of force and broader enforcement tactics?
Yeah, I mean, it's a tragic incident that happened in Minneapolis. We have seen this, of course, in the past with immigrant community members who've been attacked by ICE, not only on the streets at the border, but also, as we see now, in detention centers. Unfortunately, it's not an isolated issue. Now we have someone who died in the streets, someone who is a human rights defender now dies on the streets, in the hands of ICE. And, she become one of the other people who are now our target, under this administration, and of course can lose their life just by being there, by requesting immigration to be transparent, to protecting those who are now being targeted by this administration. So it is important to people to know also that it's a systemic problem. She is one of the individuals who died last year. In 2025, there were 32 deaths in general. That includes several people who were shot by ICE, who also were, died by ICE, immigrants in detention custody as well, some who died by suicide, some of them who died by just medical neglect in general. So it brings the level of conversation to a different level, and it's important to keep knowing that what happens in a detention center in terms of the medical neglect and abuse, people need to pay attention to what happens, and also ensuring that we hold ICE accountable, and members of Congress, people who have the opportunity to go to the detention centers, do an investigation, a serious investigation of all these allegations of medical abuse that we have reported over the years, that we have heard from people. We've been doing this work of accompanying people and hearing their stories for 15 years, and the same issues that we hear back in 2010, 2011 of abuse and neglect, we continue to see today in the detention centers. So it's an overall systemic problem that needs to be addressed, and members of Congress need to take attention, pay attention to what is happening, and also they need to investigate, full investigation on all these people who have died in these detention centers here in Georgia.
Well, we thank you so much for highlighting the issue for us from your perspective and being with us here this morning.